Hello, everyone, and welcome to the Wind Down, where we wind right on down.
Wind down from the weekend.
That's right.
From the week, not the weekend. We're going into the weekend.
Who knows? Who knows what's happening?
It's Friday.
She's drinking wine,
here.
right?
Yeah.
Come on.
Might have had a couple sips before we started. It's fine.
As you should. As I used to as well when I was partaking, but soon enough, it's fine.
Exactly.
I kind of love the topic that we're diving into. I love what's going on when it comes to just mental health and like destigmatizing it and making it like seeking help more available. And as of July 16th, people have been able to call 988 to be connected to a trained counselor. And that's the Suicide Prevention Lifeline Crisis Center, which has actually been around since 2005, but it was like, not, 911 is like...
Yeah, it was like 1-800 something nobody ever remembers, especially when you're in a crisis.
Totally. You'd have to like go and like Google it while you're feeling these feelings and then call it. And then there were major infrastructure problems that still exist, but they're working out the kinks.
Getting better, hopefully.
Yeah. And so I think, and I've always thought like, that like mental health should be taken as seriously as like our physical health. And we've always had 911. We learn it as kids. Like if something's going on, no matter what it is, you call 911.
Right.
And now, we have this, like if we're, feeling like we need help, emotionally, there is this resource that is available to everybody. It doesn't matter who you are. That I think it's brilliant.
Yeah.
I'm like, I love this. And I saw, I didn't actually like know that it was coming. I wasn't aware of it, but I saw everyone was posting about it and sharing it online, which I thought was a really beautiful thing as well. I was like, sometimes, that social media.
It does positive things.
It does. It does positive things for people.
Creates awareness to issues and new things like 988.
Yes.
I think it's so great. I think there's also, to your point about destigmatizing, mental health and the fact that it's 911 and 988.
Yeah.
Like instead of having it be like a different number combination, like obviously you can't have it be so similar.
Right.
Where people would be confused. I'm sure there will be confusion, but like for most people it is separate enough, but they're so similar. Like you're having an emergency, whether it's mental health or physical health, there's a 9 something number for you to call. Like, I think that is actually huge instead of calling it like 711 or I don't know, 511 is what?
723 or 689.
Right, exactly. There could have been a lot of different ways that they take this, but I think it's great.
It's obviously thought through. They were like, okay, we need to make this as easy for people as possible in a crisis.
Yeah.
And it's important to say that it's not just for people who are feeling suicidal. It's for anyone that's experiencing a mental health crisis. Or even people who are concerned about somebody who might be experiencing a mental health crisis.
Right. And I think that that's huge too for people to understand as a resource.
Yep.
Because there's a lot of times where the only resource people know about is 911 and it might be a mental health crisis and not necessarily a physical health crisis.
Right.
So my understanding is that one of the ideas for this becoming 988 is that it will take hopefully some of the burden off of police departments being the first people to respond to mental health issues.
Right.
And I know that there's definitely cities who have implemented mental health teams who are the first people to respond, even if you're calling 911, but that's a very few and far between case.
Right. This is very specified now.
This is very specified where it's a mental health provider and hopefully they can help to navigate who is the first person on the scene if it's a crisis that's happening right there and then, like maybe
being able to like facilitate the right
people so they can
without being bombarded
de-escalate the situation versus it ending in a tragedy, which we've seen over and over and over again.
Totally. Yep.
And there's a lot of different reasons why things end the way they do. I'm not in those situations, but you definitely do feel like there's times where it could be prevented if the right person is...
By implementing like mental health professionals, you know what I mean? That have the expertise to de-escalate potential situations from getting to where we've seen that they've gotten. And yeah, I think this is a really, good step forward. In addition, this is like, these numbers, well, not numbers. I mean, it's just, I didn't realize how, I knew that suicide was pretty prevalent, but suicide is the second leading cause of death among young people ages 10 to 14 and 25 to 34, which is like, it really is heartbreaking. I'm surprised I was surprised, but I think it's more like maybe you just don't want to like think about that or believe that, but it is... It's very common, and it's too common. And so providing, access is very important. Unfortunately, there has been some kinks.
As there always are. And hopefully, I think one of the things is that now it being 988, there's more funding going towards the hotline. So... Yes.
It needs the funding, and the funding is there, and it is already helping, which is great. But I think before the problem was that people were put on hold, or they were just disconnected. So imagine you're in a state of panic, and you're actually taking the time for yourself to make this phone call because you're like, this will be quick. Maybe someone can de-escalate the situation for me. And then suddenly it hangs up on you. Right. You're like, the universe is not working for me in this moment. You know, it's just like an added thing to the list of whatever you're feeling. Right. Or you're just put on hold for a really long time before you're even able to speak to someone. And can you imagine being in that state and like that hold music coming on? No. Like that elevator music, and you're just like, are you joking? Yeah.
You're like, I'm in an actual emergency right now, and yet this is how the universe is talking to me about this. Clearly my problem isn't big enough for somebody to respond to, so therefore I might take other steps.
Well, 80% of callers hang up after 2 minutes of being on hold, which is serious, right? And that's been kind of, the biggest complaint of the hotline is just that a lot of people like aren't even getting through to somebody. And the problem is that they don't have enough counselors available. So like they need to up, the amount of healthcare professionals that are working for it, and also just, the funding to get it like functioning properly. So, which they are getting. So that's a positive note.
That is a positive note.
All of this is like on the up and up, which is very, very exciting. So all of this is very exciting. So exciting that we're going to go take a quick commercial break, but we will be right back to talk a little bit more about it. Welcome back, everyone. We've been talking about the 988 suicide prevention hotline, which is not just for suicide, it's for any mental health crisis. That has been implemented since July 16th. Very exciting.
Very exciting.
So spread the word. I don't know, I think maybe I can talk specifically about what's been going on, how it's being funded. But the Biden-Harris administration designated $282 million in investments to implement 988 in 2021. So that's a lot of money, and another $150 million announced in 2022. So all of the kinks that we were talking about earlier are just getting ironed out, which is great, obviously, because you can't have people in a crisis waiting on the phone.
And I think, especially if it's a major crisis, like you were saying earlier, it doesn't have to be a suicide crisis. It doesn't have to be an immediate crisis. It could be you need to figure out a resource to talk to for mental health reasons. Right. And I think that that's great too. But anytime, maybe you're already second guessing your decision, if you're put on hold, if you're disconnected, if you have to wait, it's going to not only affect your mental state even more,
right? Yeah,
but also, you're probably going to hang up.
Yeah,
like who waits on hold for customer service for longer than 2 minutes?
I know.
Let alone, trying to handle something that, is bigger than you can take on yourself.
Right.
Right?
Yeah.
And I think it's interesting that it's gotten the funding starting with 2021 and 2022 because of the mental load that people have found themselves under.
Yep.
Not only because of the pandemic, like that, I think has definitely exacerbated it.
For sure, yeah.
But I think that, when we were talking off camera beforehand about how just the state of the world we're in right now, there's so much pressure and there's so much intensity.
Totally. There's so much you could go into so many different areas of like what's happening in the world that would be causing anxiety and depression and all of these things. I mean, when it comes to the pandemic and people feeling isolated and lonely, or just like this consumer heavy go, provokes a ton of anxiety too, like just trying to keep up with things, and not just taking the time to sort of breathe and recenter yourself. On top of it, we have this social media world where people are just suffering from comparison or feeling like it's like the hustle culture, like comparing ourselves to others, like we're not doing enough, we're not accomplishing enough,
my life isn't as happy as their Instagram feed, or it's not as glamorous, or I'm not as cool or as special. And again, I think we've talked about multiple times is like how curated those social feeds are, but that still doesn't stop you from it making you feel bad sometimes.
Totally. And like the younger generation, as we were talking about earlier, the second cause of, the second leading cause of death among young people, 10 to 14, is suicide. And I mean, a lot of that is likely attributed to online bullying and things like that, which is a very real thing, on top of like the comparisons and everything like that. It's like, you're in your formative years of life and like you might not have the tools to be able to like navigate that kind of weight. I mean, it is a lot, isn't it? It's hard for us.
Right. It's hard for us, but we also, I think, are at a stage in our lives where we had so much time before social media, where you understand that it's a difference between reality versus an online persona, almost.
This is why I'm scared of the metaverse, people.
And I think this is something that definitely makes me worried as a parent. What is this going to be in 10 years when it's something I have to deal with? I don't know, maybe even sooner than that. Hard to say. But I think that's the scary ththing is that, these kids who grow up digitally native. Yes. I just sounded really old there. Thank you.
I like that, though. I've not heard that.
But, it's a blurred line for them. Their online persona or somebody's online persona versus like reality.
Yeah.
And it's hard to not compare yourself to what other people are doing or what they're posting or who they're with, or finding out on social media
FOMO
that all your friends are together and you weren't invited.
That was the end of the world back in the day, even without social media. And now like kids can be nasty and they'll rub it in your face through social media, right? And it's like, I remember like the whole, like kids just do mean things to each other. Like they'll just randomly like kick someone out of the group for a while and then like you have to earn your way back in or whatever it is. And when you're young, you can't see the bigger picture. You don't have enough life experiences to see that like this is a moment in time and like, you know what I mean? Like this isn't forever. And it feels like the end of the world. It
feels
really
like
does.
The only thing. Yes, exactly. And this is like the biggest thing.
Yeah.
Absolutely.
Yeah. It's the mental health crisis just in the world right now, that we're experiencing. I mean, this is such a necessity to have resources just at our fingertips. And another thing I wanted to talk about was just, because I've had this before where I was like, I think I need a therapist right now. I think like, I'm like checking in with myself. I'm like, yeah, I think I need a therapist. And, it's not easy. This is not like
easy to find one.
No, this is not an overnight thing. And not to mention, even once you get one, you like having somebody that resonates with you is super important. So like there is a trial period, like when you start therapy, because everyone needs different things.
It's like dating.
It is kind of like dating, and it's so personal and intimate. But I just know like, it's like, who takes your insurance, right? And then you'll maybe get a list of therapists in your area under your insurance. You can use ZocDoc. That's a resource. And then you go and you're like, oh, their next available appointment is in 3 to 6 months. And you're like, well, I needed you now.
Right.
You know what I mean?
Yeah, I need you like maybe this week. Okay, fine. I could probably wait till next week. But like 3 months from now? Not great.
Yeah.
Not good for me.
And then
Not
you're
good
like,
timing.
well, this person with 1 star is available next week. I guess I'll try that. It's just a whole thing. I think now with like telehealth opening up and becoming available since the pandemic, I think that was another brilliant thing.
Yeah.
I mean, my sister's a psychologist, and she just can work from home now.
Which is great.
It is great. Yeah. It's like, it just creates more time for everybody. It just like, because you have to factor in like people traveling in and out of work and all of this stuff. And like, it opens up doors to more people. I think it's brilliant. Of course, in person is really nice, but I do think with like therapy, it's not like they're having to check your like body. It's you're communicating.
As long as you can feel that connection through the computer or phone or whatever the case may be, it's great that there's different ways you can connect with somebody.
Right. And you can wear your pajama pants.
Right. Because you might not want to get out of them. I mean, regardless of your mental state, but like they just might be comfortable.
No one was used to wearing pants like after the pandemic. Everyone's like,
still not.
Yeah, I know.
Especially during summertime. Yeah.
Oh my gosh. Yeah.
Hard
it's
pass.
Like a summer slip, basically, that just sits over my body. That's basically what I roll out of bed and put on. You know what I mean?
Exactly.
Especially in these heat waves. I'm like, oh, it's so much.
We're going to take another quick commercial break, and we will come back and talk a little bit more about mental health.
See you soon. Welcome back, everyone. We are here still talking about the 988 mental health crisis hotline.
Woo!
Yes, we celebrate.
I think we're really excited about it here. One of the topics we haven't covered that is super important for 988 is the fact that Black and Brown communities have a harder time accessing mental health resources. And typically, they're the communities that are accessing it through the police, through jails, and other major crisis situations. And I think that, mental health is typically super expensive. Like you were talking about, like, find out if you have it through your health insurance. You might not. You might have to be paying for it out of pocket. And so to be able to have this hotline put in place where kind of what we were talking about earlier, where if there's a mental health crisis that is not yours personally, but maybe it's a loved one who's going through something, and you're able to call 988 to help diffuse the situation, instead of having
to call
911, because you are worried about not only their mental health, but also their physical health. You're able to help, somebody in your community handle the situation hopefully a little bit better and help them get better. But then also for people who aren't having a major crisis, but they do need mental health help, to get resources where maybe, there are so many free resources. You just have to know where to look. And so to be able to connect with this hotline in order to do so, I think is super important.
That it's fair for everyone across the board. It's something that is available for everyone across the board and can just, help connect you to things that are healthy and good and proactive, I know my sister was telling me, I mean, there's so many things about our healthcare system that just need a little work. Because unfortunately, like often quality comes with what kind of health insurance you have. And my sister has talked to me about that in depth, about how people with better insurance will get better mental health care than people with not as great health insurance. So the people paying the big bucks for that independent, like private health insurance.
Right.
You're going to get more quality help than somebody who doesn't have like the fancy schmancy.
Right. Or if you're able to pay out of pocket because you just have that ability to.
Right.
Because there certainly are mental health professionals who don't even take insurance because it's too hard for them to deal with.
Absolutely. And
which is a whole different billing situation. Like, I totally understand that too. Like, it's hard.
And well, the people that are, and not to say like the super rich don't have mental health problems, because they do, but like the majority of the people who really, really need that help, are people from poor communities, and
right.
And if it's not available to them, then there's so many kinks that need to be worked out. But what I like is that this is a step towards getting people the help they need without them having to scramble and take all of these extra steps that they probably don't have the energy or the means to take in order to get it,
Right.
So
it's a little bit more equitable. I mean, it's steps towards that. There is things are not equitable, but but at least it's,
you still might not have access to that therapist.
Right.
But they might put you somewhere else that is,
good care.
Yes.
And it's somebody who cares about you and understands where you're coming from.
Yes.
And what resources you need help with.
Right.
And how to connect you with care, where if a financial burden of having a mental health professional help you is not something that you can handle, whether it's you don't have health insurance or your health insurance doesn't provide for it.
Right.
But connecting you with the resources that can help no matter your situation. I think it's huge.
Yeah, it is. I mean, we need this now more than ever. And I just think it's great. I mean, it's all like hand in hand. It's like we are all becoming a little more accepting of the fact that like mental health is important and it's real, and mental illnesses are real. And it's not like a weird, scary thing. It's just part of life. Just like, if you, break a bone or whatever, you go get it fixed at the doctor's. It's just, it's okay. Like, we all struggle. And, I'm very excited about it.
Me too. Me too. I think it's a good step forward.
Yeah, it is a good step forward. Thank you all for joining us on another episode of The Wine Water Down for the next couple months. Hopefully not too much longer than that.
That'd be a different conversation.
This baby is growing. It's growing. I guess we'll see you next week with some more exciting topics.